Good evening, and as I promised, I am doing this live to be answering the most debated topic on does breastfeeding cause cavities. So I had written a post that went really viral, both in Facebook as well as on Instagram earlier. But then I realized somewhere recently that um, though the text was there, there's a huge necessity that I also talk to all of you. So it's going to be a talk that's going to highlight this topic. So before I go on to the topic of breastfeeding, first the entire communication is going to be English because we have audience from across the globe listening to this. Now, what is a cavity? In layman's term, cavity is something that you all think a hole inside the tooth where food gets stuck. But technically, ideally, medically, cavity is an infectious disease which is transmissible. That is, it's a disease that's caused by bacterial infection, and it can transmit itself from person to person. It can go from person to person. Now, going on to the big question, like what causes cavities? So, a lot of you here are very aware that cavities are caused by sugary foods, cavities are caused by plaque in the teeth, and cavities are caused by bacteria. So, let me tell you how cavities are caused. For a cavity to be caused, it needs a tooth structure, it needs some plaque on it, or rather the tooth dirt, the yellow thing that you see on it. It also needs bacteria and food for bacteria. So the food for bacteria is sugars that we say, but technically sugar is nothing but carbohydrates. Okay, so now this is how cavities are caused. You have a tooth structure, sugar, and also bacteria that causes the cavities. But then, having said this, let's take any diseases. Like for example, we have the pandemic that's happening now. We know that's a virus that's causing the disease. And now, why is some people affected by this and why is some people not affected by this? Now, that is where risk factors or comorbidities plays a major role. Okay, so what are risk factors and what is comorbidities in terms of cavities? For any other disease, like say for example in this pandemic for the novel coronavirus, the COVID, we say the risk factors is obesity, the risk factor is age, and so on. So looking at the risk factors for cavities. So one of the major risk factor is the maternal oral health. So research have proved that when mothers have cavity causing bacteria in their mouth, they transfer it to the child vertically. So how they transfer it to the child vertically is when they are in close association with the baby, when they kiss the baby through saliva, or in case they are feeding the baby, when they feed and then they give the spoon to the child, so they transmit bacteria, because ideally this bacteria is formed only after the hard structure, only after tooth is formed this bacteria starts forming. But a lot of children, this bacteria gets much earlier into the mouth. The reason why it gets earlier into the mouth is because there is a maternal transmission, that is from the mother to the baby, there is a transmission. Now also going on to the other things, maternal nutrition. Now one thing you all have to note is this tooth, whatever the children have, the 20 milk teeth that the children is having, along with along with the permanent teeth, starts forming inside the uterus, that is starts forming when the baby is inside the mother. Now for the tooth to form, the tooth will need calcium particles, it will need hydroxyapatite, it will need certain things, and now that comes from mother's nutrition to the baby. So if a mother has less of nutrition, if the mother has health issues, these tooth are affected when the tooth is formed inside the uterus itself. Now going on to the next thing is called tooth quality. So now when the mother has nutritional issues, the quality of the tooth is not as good as a tooth that received good nutrition. So we call it in technical terms as hypoplasia, or rather to say, if you look at the white layer of the tooth, let us consider this white layer of a tooth as a sieve, or a screen on top of the tooth, and the screen is weaved on top of the tooth like this. So when you have enough calcium and hydroxyapatite and all these things, it's a tight weave. But when we don't have this, when there is a void, these weaves are loose. So you see actually voids inside this tooth, and we call it hypoplasia, or the tooth with low quality. Now another risk factor is the saliva. For some children, if you see, the saliva will be very sticky. It forms strings, that is when they cry and they open the mouth, you can see strings of saliva. This is sticky saliva. You need a saliva that needs to be flowy, and you need saliva that's loaded with good minerals like calcium and magnesium to be actually protecting the tooth. Then another important thing is how much of frequency of exposure of sugar or of food. So let's, for example, digestion starts inside the mouth. Digestion starts from the mouth and not inside the digestive system. So what happens when there is, when you eat a food is, there is acid secretion that happens inside the mouth. So be it milk or be it any food, as soon as you have it, there is acid that starts secreting inside the mouth. Now this acid, after a certain period amount of time, when the digestion starts, it becomes neutralized and it becomes alkaline or neutral pH. Now you need to understand that when there is a repeated exposure, there is a long term that these acids are there in the mouth. Excuse me. So when this long term the acids are there in the mouth, it increases the risk of the tooth to get cavitated. Now another important thing that you'll have to note is the structure of the tooth. So especially this goes hand in hand with the back tooth. So the back tooth has structures called the cusps, or it has ups and downs and grooves. This is basically nature's way to help us grind our food. Now some children will have this groove that is deeper, some children will have it shallow and easy to clean. Another major thing is socioeconomic status. So worldwide, socioeconomic status really plays a major role in the cavity. So what is exactly socioeconomic status is, in the Western country, if you see, it's usually the low socioeconomic status that are under high risk of developing cavities, because easily available over the counter sugar or processed food. When you look into our system, or rather in Indian scenario, the access to the over the counter or processed food is more to the middle or the upper socioeconomic status, and they are under more risk. Education of the family about maintenance of hygiene is another risk factor. Fluorides in your water is a risk factor, and systemic diseases. Imagine children born with a condition where they are repeatedly under medical care, or they are under repeated medications, they are under repeated syrups, then this increases the risk, and also eating behaviors, the way they eat. So I'll have to really point out the eating behavior here. So when a child has a tendency to put the food to the side of the mouth and eat, then they pouch the food, then chew and swallow. So when you pouch the food, you increase the risk of the acid presence for a longer time, and then this directly increases the risk of cavities. So there are so many comorbidities, or so many existing risk factors for the development of cavities. Now why do I talk about all these things? So usually breastfeeding, or the risk of breastfeeding causing cavities doesn't become a point of conversation until 6 months. It's usually after the age of 1, after the child starts weaning or the child starts getting the teeth, is when it becomes a huge risk factor. So having said all this, it's not theoretical experience that I'm speaking. Talking to you, I'm a mother of 2 children. My first child was exclusively bottle fed, didn't have the advantage of breastfeeding. It was bottle fed on demand up till the age of 1.4 years. Grew up without any cavities. My second child was exclusively breastfed, on demand breastfeeding up till the age of 2 years, and again grew up without any cavities. He's 3.5 now. So this is where I want to introduce you the term of comorbidities or existing risk factors, than just blaming extended breastfeeding as one of the reason for cavities. Now what correlation does breastfeeding has? So now we will have to know that. Yes, breast milk has sugars. Just like your formula milk, breast milk also has naturally occurring sugar, and this is a proven fact. But one good thing is that breast milk also has your immunoglobulins, or we call it as the IGs. So this is something that is not present in your formula. And when you look at my practice, it's almost 14 years since my journey into pediatric dentistry, and almost a decade into preventive pediatric dentistry. And what I have seen is, I have seen exclusively breastfed children and exclusively bottle-fed children both develop cavities. So children who are exclusively breastfed up till 4 years and 5 years have also developed cavities, and children who are bottle-fed have also developed cavities. Okay, so now this is where the clinician's understanding on function plays a major role. So it's not just the feeding, but we also will have to look into the aspects of coexisting risk factors. So that's where function plays a major role. So the mouth has self-cleansing ability. Now we all know that cleaning is one of the things that is external with your toothbrush and everything, but do you all know that the mouth also has self-cleansing ability? So for those of you listening here, if a food particle is stuck on back of your teeth or somewhere in your sulcus, in your front gums, what do we automatically do? We put our tongue there. We try to clean it and take it out. So the tongue and the muscles around the mouth has a natural tendency to do the cleaning. So this is where I'll want to introduce the world of functional dentistry. So it's not just milk, it's not just risk factor. If the mouth is not functioning really well, is also a risk factor for the child to be developing cavities. So I'm going to shift the screen to the opposite side so you can see what I mean by function. So this is a child, this is a picture of a baby. That's breastfeeding. So ideal breastfeeding should have the nipple go inside this much. The lip should flange out, the tongue should move out, the tongue should move up, and get the breast nipple into the mouth, make it a teat, and that's when you suck milk. And when you actually establish this ideal latch, what you actually see here is the milk is directly transferred into the throat. There won't be any scatter of milk. Unfortunately, when the mouth is not functioning really well, when the tongue is not moving to its optimal potential, or when the lip is not moving to its optimal potential, we cannot make this deeper latch happen here. So what happens is the child still sucks on. Many of the children, majority of the children become successful in sucking on, but what we have is there is milk scatter all over. So there is no direct transfer of the milk into the throat. So this is where function plays a major role. Apart from this sugar, apart from bacteria, apart from all the other risk factors that I spoke to you about, this is one of the major thing that we'll all have to note, that is the breastfeeding process in the right latch, or is the latch deeper? It's very easy for all of you who are mother here to check. So after a milk feed, you open the mouth, and if you see milk scatter all around, you can see milk scattered. So that is a huge risk. Now, having said all this, we spoke about the risk factor, we spoke about, it's just not breast milk that is causing the cavities, it's the risk factor associated around it which is causing cavities. Now, what are cavities? Infectious disease. How do cavities occur? Does it happen overnight? No. Cavities doesn't occur in a mouth overnight. Cavity, before showing up as a black lesion or a brown lesion, shows some signs and symptoms, shows some signs inside the mouth that this tooth is going to become cavitated. So this is where I'm going to take you all to help observe this and go into prevention much earlier. So these are few pictures of children at various stages of cavity. The first two are normal teeth. The second two are initial stages of cavity lesion. This is where you will have to note, cavity doesn't happen like this overnight. The cavity before it happens shows signs. Can you see these bright white spots here? these are the signs where the child can probably get cavity in future. Now from this bright white, it's a sign showing that the minerals of the tooth is lost. From here it becomes yellow, and from yellow it becomes like this, it starts breaking out. So cavities doesn't happen overnight. Cavity starts showing signs even before it's very obvious, or it goes into the stage where treatment is needed. So now what to do? The best thing is to see your function focused preventive dentist as soon as the first tooth erupts or by the first year of age. In case you're a mother that's planning to extend nursing, then this is the best thing. So get the risk assessed. So your dentist who is function focused will not just say stop breastfeeding, will not just give you few prescription of toothpaste or medications to prevent cavities. What they would actually do is they will take you through a risk form where they look at various aspects and they narrow down to the risk. So get your risk assessed. Start hygiene practices early. Yes, we start brushing as soon as the first tooth comes, but even before brushing we start gum pad cleaning and gum massages. Your practitioner should be able to help you with this. Function focused practitioner can help you assess the risk, address this risk of your choice of extended breastfeeding. The breastfeeding time is decided by the mother and the child. None of us as healthcare providers has any authority to decide that when a mother or child should wean off. So the best thing is to start looking out for a function focused practitioner who will actually help you assess the risk, guide you to ensure that the child has healthy hygiene and still be able to breastfeed for longer duration. And now as a small tip for mothers, in case you're not able to look out for a practitioner now, what is that you have to do? Ensure that you have a deeper latch. The mother knows the best. So what to do when we have deeper latch? After you unlatch, see if there is milk scatter. So in case there is milk scatter, then probably you will need help with the latch. When you get the latch to a deeper level, the risk of the milk scatter is gone and the risk of cavity is gone. Usually by the time we are thinking about cavities, the child is also on other foods other than breast milk. So don't just get focused to the point that it's the nocturnal feeding or it's only the breast milk that's causing this. Also look at the risk factor of exposure of other foods, how frequently the child is eating, how is the child chewing and eating, does the child pouch and eat, how is the acid secretion of the mouth, and all these factors you have to assess. Start hygiene practices. So even if your tooth is not there, if your child wants to nurse to sleep, I nursed my child to sleep up till 2 years, and no, we don't have cavities because we took care of other issues. So what you can do is you can unlatch the child after the feeding is over and then probably give the child a little bit of water if you're not sure about the latch. So if the latch is completely ideal, then the milk directly gets transferred to the back of your mouth, so there is no chance of it getting stuck to the teeth. Now another important thing is your lip. There is a tissue on the lip which attaches the lips to the gums, which we call it as frenum. Sometimes this can be a little tight and we call it as a lip tie. When there is a lip tie, the ability for the lip to move and self-cleanse is very, very less. So in case you have you think that, I'm so sorry, it had to get cut. In case, I hope I'm on track. So in case you are worried about your child self-cleansing, please start hygiene practices much early. And yes, do not be shocked. I'm going to turn the screen and show you again on how to look out for cavities. Cavities doesn't happen like this overnight. There's nothing to be shocked. The tooth that is going to get cavitated will show you signs and symptoms even before it becomes really damaged. The signs that you'll have to look out is for these white spots. I'm sure you're able to see the entire tooth is in one color, and can you see the white area here, white area here? This is the area that is actually started becoming rough, or calcium has started losing. So this is where the bacteria can go and get settled, and when the bacteria gets settled here, the entire process of cavity starts. So start looking out for early signs. Observe your child's mouth and teeth every day when you're brushing. lift their lips, retract their cheek and see if you can see white signs or white spots or yellow signs. So in case you see white spots and yellow sign, a function focused practitioner would always might give you some creams, tooth creams, which is remineralizing, and give you a instruction on your diet and nutrition and your cleaning practices, and still able to help you breastfeed and extendedly and help you in the breastfeeding journey. So ending this with one small tip, in case you're seeing your child have this white spot lesion, one of the things that can help heal this lesion is a substance called casein, and this casein is extensively available in cheese. So these non-processed, non-sugared cheese, or the natural cheese has a lot of casein in it. You can give these cheese to the children to chew it through the day like chewing gum, and chew and swallow. One thing, when they chew, is they secrete a lot of saliva, which will help in cleaning the teeth. And second thing, the casein inside the cheese actually helps in remineralizing these white spots. Having said all that, concluding, in case you were said that you'll have to stop breastfeeding because it might cause cavity, no, breastfeeding is not the reason for causing cavities. You will need to find a practitioner who will actually can help you through the risk assessment. So maybe it's not breastfeeding that's causing cavities, it's your latch that is causing cavities. Breast milk has immunoglobulins, but breast milk also has sugars. But these sugars are not as harmful as processed sugars that is there in your formulas. Yes, and you can still breastfeed your child extensively, extended, as far as you and the baby wants, without getting cavities. That's Dr. Shifa for you. See you all on a next myth breaker. Bye.